Now, stroke cases have risen over the years, with 1 in 4 people expected to suffer one. And doctors also say they are treating more cases of wake-up strokes, or strokes that happen when someone is asleep. Now, such cases make up almost 1/3 of all strokes. Associate Professor Deidre and Silva from the National Neuroscience Institute joins us now to shed more light on this in line with World Stroke Day today. Well, a warm welcome to Singapore tonight. Let's first talk about wake-up strokes. So how can we tell if we've had one, say, during a sleep? And I'm also wondering in just which part of the sleep cycle such strokes actually take place.
Good evening. Thank you very much for having me today. Wake-up strokes can happen at any time when you're asleep. And often strokes are asymptomatic, meaning that you will not feel pain, and so it will not wake you up as a result in terms of pain. And when you get up, you will realize the symptoms, which may be that you have weakness when you're getting out of bed. When you look into the mirror, you may find that your face is drooping on one side. When you are drinking, you're drooling, and you have difficulty speaking to somebody. And those are the signs that you will notice. And because during sleep, you won't notice these signs, and there's usually no pain with strokes. You only notice it when you wake up. In response to your second question, it can occur any time from the time you fall asleep till the time you wake up. And because we sleep for about 1/3 of the day, about 1/3 of strokes actually occur during sleep.
And are wake-up strokes more difficult to treat, and are they treated differently from normal strokes?
So the thing that is difficult is because we can't tell from what time the stroke actually occurred from the time to the time that you woke up. It's a little bit harder for us to determine what treatments might be safe and suitable. But fortunately now we have some new brain imaging studies which we can do. And based on certain patterns, we can tell that the stroke happened closer to the time of waking up. And if that's the case, then we can offer patients some of these hyperacute stroke treatments to unclog blood vessels, either with medicines, clot-busting medications, or to mechanically actually remove the clot. So as a result of these advanced imaging, we now can treat many more strokes.
Also, aside from wake-up strokes, incidence rates of stroke among those below 60 have also risen, while that among those above 60 has dropped. Why is that the case?
So you're exactly right. 40 to 60 years of age, the incidence has gone up by about 15%, whereas in this above 60, it's either flattened or come down a little bit. And we think that this may be because younger people maybe don't go for screening, and they therefore don't know about risk factors that they may have and are not taking care of all these risk factors. And maybe they're a little less good about lifestyle factors. And so really, actually, once you're over 40, you should be going for screening. This includes blood tests for cholesterol and diabetes. And everybody, once they're an adult, annually should have a weight measurement and as well should check their blood pressure because 80% of strokes are preventable. So we should know our risks. And once we know our risks, we can then reduce the risk.
That's good information to know. Thanks for speaking to us this evening, Associate Professor Deidre and Silva from the National Neuroscience Institute.